Good afternoon, and thank you for joining us. Once again this week, we are very pleased to see that we have remained in the red tier on the state's blueprint for reopening framework. That allows us to keep some businesses open with restrictions. Again, this is good news due to the work of our incredible county health staff, our nonprofit community partners, and our hospitals and medical professionals who have continued to aggressively provide testing throughout the region with the end goal of moving down tiers. Our testing numbers remain strong and are a crucial factor in preventing our region from being pushed into a more restrictive tier. We know that staying in the red is not enough, and people and businesses are still suffering. That's why yesterday our County Board of Supervisors agreed to several key reinvestments to provide assistance to those impacted the most by this pandemic. We voted to redirect unspent CARES Act funding and prioritize it on investments to support our most vulnerable residents, nonprofits, and small businesses who are all doing their best in weathering this pandemic. The reallocations include the following: $3.8 million to continue our testing, tracing, and treatment efforts. $5 million to assist behavioral health patients with rental assistance. $1.6 million to continue supporting youth in our child welfare system, including stipends for child care providers. $7 million to award more economic stimulus grants to small businesses, with the money being equally divided among all 5 supervisorial districts. $3 million to expand our emergency rental assistance program for low-income families. $2 million to support our local food banks, and $1.6 million to continue serving meals in our Great Plates programs, with any leftover dollars from the programs being redirected to the food banks. We know these are tough times. This will help people and businesses that are struggling to cope with the economic fallout from the pandemic. Yesterday, the board also heard from a panel of outside experts who are partnering with us on the disease investigation aspect of our response. We got an update on our contracting tracing efforts, and we also heard about our efforts to vaccinate people for the upcoming flu season. That will be critical this year, more so than ever, to avoid a double whammy from the flu and COVID cases. And I want to remind everyone and urge everyone to get your flu shots. If you need information on helping finding a location for free flu shots, please contact 211. With that, we'll move into our updates, starting with Supervisor Fletcher, and then Dr. Wooten will give us our medical update.
Thank you, and good afternoon. As was just mentioned, San Diego did remain in the red tier. The good news in regards to that is our situation is not getting significantly worse, but the bad news is it's not getting better. We are creeping up a little bit, some instability week to week. I can say we're holding steady, but we are living on the edge and the precipice of going into that higher tier every single week, and that causes great anxiety amongst our community, our small businesses, our team here, wondering week to week what will happen. Over the last few weeks, we've been aided significantly by the state's readjustment factor, adjusting the case rates based on our testing, and we've been aided by a very robust testing program, now over 60 locations countywide, and significant increase in our testing. But we want to be in a position where our numbers are descending, where the conversation is, are we at a point we might move into a lower tier? And in order to do that, it is going to take each and every one of us continuing to make even increased effort. While we know the overwhelming majority of San Diegans are doing everything right, they've got in a routine about wearing their mask, they're avoiding large indoor settings, they're physically distancing people they don't live with, they're washing their hands. The reality is we'd like to see our case counts descending. That not only gives us the potential opportunity to open up a few more things, but more importantly, it gets us off of this weekly cliff that we stare down. But it's not just us. Riverside County, a little bit smaller than us, but certainly a large county, is struggling, perhaps moving back into purple. Smaller counties, Shasta went from orange to red. Tehama went back to purple, and we're seeing a lot of places around the country. And so San Diegans doing a good job of holding steady and holding the line. But we really want to redouble our efforts as we continue through October and prepare to head into November to see those case counts decline, which will give us more opportunities, more security, and more comfort as we move forward. We've also been working closely. We know there's been a lot of interest around schools, and Dr. Wooten is going to talk more about this, but we've been working with superintendents, with Dr. Paul Gothold, the county superintendent of the County Office of Education, around standardizing the reporting for how many schools are open and in what configuration. Dr. Wooten will be updating her public health officer's update to provide some clarity to schools needing to share that information on a regular basis, and we will work out reporting procedures around cases tied to schools, and we expect to have an update on those procedures moving forward for how we can more accurately reflect how many schools are open in what configuration and what the public health situation looks like for each of those. With that, let's jump into our numbers for today. Again, you see our testing numbers holding very strong. You know, as we've seen a significant increase in the number of testing, we've been able to maintain the integrity of that rapid turnaround testing time. Our hospitals here a little improved from where we were a week ago. Public health lab continues to be between 1 and 2 days, with the Helix County partnership being under 1 day. This is a great step forward and certainly aids in our ability to case investigate and contact trace. But here again, you see all forms of testing doing much better than they have done historically, which is good, as we've seen an increase in the recent weeks in terms of number of tests. For today's cases, we're reporting a total of 303 new positive cases out of today's total of 9,662. Again, it's not day-by-day numbers that are as significant as the 14-day rolling percentage of average, which you see reflected there in the purple line, trending up ever so slightly, but generally holding steady, in large part due to the significant increase in testing, which you see going on right there. Hospital census, again, relatively stable, 74 ICU-related COVID beds, 244 total, again, almost exactly where we were going back a month ago, and if not down a little bit, and so holding remarkably steady. Total COVID hospitalization, the 244 of the COVID, 4,495 total. Again, on our total hospital bed census, which you see right there, you see us holding steady below the 80% occupancy number. Next chart for us today, our ICU bed occupancy, again, holding remarkably steady right there at 67%, 74 COVID, 390 total, and again, remarkably consistent across the board. Final chart here today, you see our 7-day average of testing, over 10,000 tests. Great credit to our testing team and all of our healthcare partners. Percentage of positive at 3%. Case investigations, contact tracing remain very strong. More than 58,000 total case investigations performed, and the treatment numbers you see there on the right-hand side. That concludes my update. I'll now turn it over to Dr. Wooten for her public health officer's update.
Thank you, Supervisor Fletcher, and good afternoon, everyone. As of today, there are over 38 million confirmed cases worldwide and over 1 million deaths. Nationwide, there are almost 7.9 million cases, which includes over 216,000 deaths. For today's local numbers, the county is reporting 51,327 cases, which is 303 more cases than reported yesterday. And this overall total number of cases includes 844 deaths, with 4 new deaths reported since yesterday. Now, the age range of cases is from 0 to 102 years of age, unchanged over the past month or so. 29,637, or 58% of the total number of cases, are 20 to 49 years of age, and this number and percentage has remained consistent for the past several months. 26,269, or 51% of total cases, are female. 24,926, or 49%, are male. 3,710, or 7% of all cases, have been hospitalized. And of that hospitalized number, 858 have been admitted to the ICU. And this ICU number is approximately 2% of the total number of cases and 23% of the total number of those hospitalized. And the total number of cases includes, as stated, 844 deaths, which represents 1.6% of the total number of cases. Now, focusing on demographics related to the hospitalized cases, of the 3,710 total hospitalizations, 2,669 cases, or 73% of the total number of those hospitalized, are among those who are 50 years of age and older. Males represent the majority of those hospitalized at 2016, or 54%, and Hispanics or Latinos represent the majority of hospitalizations at 2,135, or 61%. Regarding demographics related to deaths, 367, or 43.5% of those who have died were female, and 477, or 56.5%, were male. Of the 844 deaths, 805, or 95%, had underlying medical conditions, meaning 5%, or 39 of those who died, did not have any underlying medical conditions. The top three categories of underlying medical conditions include hypertension, diabetes, and heart disease. Now, moving to our triggers dashboard, community outbreaks. This category is currently the only metric that has exceeded the threshold. Today, we are reporting 47 total community outbreaks for the past 7 days from October 7th through the 13th, which represents 186 cases. As of today, 4 new community outbreaks were reported in the following sectors: 2 in businesses, 1 in a restaurant, and 1 in a restaurant/bar. Now, you have likely noted that the number of community outbreaks is one of the 13 metrics that we monitor. It is important to note that this metric is used for public health surveillance in an effort to provide a big picture view of the county's COVID status. This metric is not used in the state's evaluation of our tier status. A community setting outbreak is defined as 3 laboratory-confirmed positive cases from separate households that are epidemiologically linked within a past 14-day period. Importantly, it does not mean that these individuals were confirmed to have contracted the virus at the outbreak location. We actively assess the outbreak location to see if it could be possible that transmission could have occurred at this site, and it is possible, if it is possible, as a transmission location, we work with those at the site to minimize any ongoing risks, and will determine the location as a confirmed outbreak site. As I and others have mentioned in the past, if an outbreak setting is deemed a threat to the public's health, and if there is an action the public needs to take to protect themselves, we will make the public aware of the location of the outbreak, as illustrated recently when we made public our work with SDSU to mitigate the outbreak that was going on there. Now, with roughly 95% of the county's COVID-19 related cases not related to an outbreak, this is a clear indication that COVID-19 is everywhere. Now, as previously shared, the Blueprint for a Safer Economy has the tier framework with metrics and thresholds for each county to open more sectors. The system is based on levels of disease transmission, which include widespread, substantial, moderate, and minimal levels, which represent tiers 1 through 4 respectively. Now, as of yesterday, Tuesday, October 13th, San Diego County remains in the tier 2 or red tier, along with the bordering counties, Riverside and Orange counties. Remaining in the red tier means that there is still substantial spread for transmission of COVID-19 in our county. The adjusted, or rather unadjusted, case rate yesterday was 7.2 The adjusted case rate is 6.8. The positivity rate for the entire county is 3.0, and the health equity positivity rate for the lowest quartile of areas in San Diego County, the testing positivity is 5.7%, which is down from 6.2% last week. Now, initially with the new state monitoring system, the case rate and testing positivity were the core metrics. And if the counties, these were the core metrics. The state testing rate is equally important as it is used to calculate the adjusted case rate. If the county testing rate is above the overall state median testing rate, this lowers the county's case rate. However, if the county testing rate is below the state median testing rate, the unadjusted case rate is adjusted to a higher case rate. Yesterday, the adjusted case rate for the 7-day period from September 27th through October 3rd was 6.8 per 100,000 population. So again, this keeps us in the red tier. And our testing positivity was 3%, which actually is in the orange tier. But if you have two different tiers, the county is assigned the most restrictive tier, which for us in this case is red. Overall, the county continues to be in the red tier or tier 2. Now, as shared last week, in addition to the county case rate and the testing positivity, the health equity metric is the third and the newest metric that is used to monitor the county's status. The county's health equity metric is based on the Healthy Places Index, or HPI, which is based on census tracts looking at those social determinants of health that are identified in the green boxes to the left. There are 8 of them, from economic, education, transportation, social conditions, neighborhood conditions, housing, clean environment, and healthcare. As seen on the next slide in the map, using the HPI score, San Diego County is categorized into 4 groups. The top group, or the highest 25th percentile, is the most healthy communities in San Diego, and these are all in dark green. The next highest group is in the 50 to 75th quartile, which is shown in light green. The group in the 25th to the 50th quartile is shown in light blue, and finally the group in the bottom 25th quartile, the lowest quartile or least healthy communities, is shown in dark blue. Communities on the map shown in the white hash or dashed areas are military bases and are not applicable in the included in the HPI model. The dark blue regions to the right on the right side of the slide are mostly tribal nations. Also on this map, the black dots, it might be difficult to see, but the black dots represent all of our county's testing sites as of October 9th, and these are well matched to the lowest quartile areas. Members of the public can visit the healthyplacesindex.org to assess more information about the Healthy Places Index. Now, going to the next slide, based on statewide data, we know that COVID-19 is disproportionately impacting certain communities, in particular the lower income areas and areas where people of color live. Most of these communities are in the areas identified in the lowest quartile. Like case rate and countywide testing positivity percentage, the health equity testing positivity percentage places counties in one of these 4 tiers. It is important to note that unlike the other 2 metrics, case rate and overall testing positivity, the health equity metric will not move a county to a more restrictive tier. Again, as mentioned earlier, this week the state released the health equity metric for the lowest healthy communities at 5.7% for San Diego, which is decreased from 6.2% last week. As seen in the next slide, And on the following, as seen on this slide, this basically shows the categories for a health equity investment plan that all counties are developing and will have to submit to the state on Thursday, tomorrow. And all of these areas, we are gathering information for immediate strategies, long-term strategies, and cross-cutting strategies, either current and ongoing activities in these areas, as well as expanded activities in these areas. And we will be submitting again this report next, rather tomorrow. The county future activities will include expanding new testing sites, increasing epidemiology and laboratory infrastructure through the epidemiology and laboratory capacity funding that the county has received. These efforts include expanding whole genome sequencing for pattern recognition, increasing dedicated teams for pre-outbreak assessments and responding to outbreaks in the field, and conducting a serological survey to determine the true COVID-19 incidence in San Diego County. Now, let's move to a discussion related to schools. The county is working closely with the San Diego County Office of Education to prevent the spread of COVID-19 at schools for in-person learning. The San Diego County Office of Education updated their school district in-person reopening report and tracker tool. And as of today, based on a survey that results that we obtained today from the San Diego County Office of Ed, the current number of for reopening of 42 school districts includes the following. We have 27 districts are open to some or all students. 6 districts will open later in October, from the 5th in October, 5th through the 19th, and 1 to be determined later in an undetermined date in October. 3 districts will open in November, and there are 3 districts that are targeting to reopen in January 21. 1 district is still working to identify a date in October or November, and 2 districts will determine their start date at a later time. So we will amend, as has been stated already, our public health order to receive additional information from all of the schools and districts in regard to the number of students that are currently participating in in-person learning, as well as distance learning or a hybrid. And we will continue to work with the San Diego County Office of Ed on this process and keep everyone informed on our progress with the reopening of schools across the county for in-person education. Next week, we will provide more details on this process. Now, amid the COVID-19 pandemic, more than ever before, it is important to get the flu shot for everyone from 6 months of age and older. And if you are not able to obtain a flu vaccination from your local healthcare provider, the county is offering 6 vaccination sites starting October 27th through November 3rd. We all play a role in reducing transmission rates of flu in our community, which also helps to keep people out of the hospital. So please protect your community by getting your flu shot this flu season. In our next slide, as I close, and I would like to remind everyone that we can and will address the challenges of COVID-19 successfully only if we all work together. So by conducting and adhering to these non-pharmaceutical strategies or prevention measures, washing your hands, staying 6 feet apart from others, wearing facial covering, avoiding crowds, parties, and gatherings, large gatherings, and staying home if you're sick. All of these factors help to decrease our testing positivity and decrease our case rates. And by decreasing testing positivity and case rates, in the next slide, these actions will help to open up further sectors by helping us to move to the less restrictive tiers. So thank you for this opportunity, and now I would like to welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. We're going to go directly to the questions.
The first question is from Brandon Lewis with CBS 8.
Thank you. Dr. Wooten, once you submit the report tomorrow on the Health Equity Index, how long do you think it'll take to start seeing improvements in these communities that will help our case rate?
Okay, Dr. Wooten.
Well, as you can see, since last week, the testing positivity for the lowest quartile decreased to a lower 5.7% testing rate. So we will continue these efforts, and these efforts did not just start yesterday. We've been conducting these various strategies that are recommended by the state basically since day one in our response to this COVID-19 pandemic. So as we continue what we're currently doing and expand from testing to contact tracing, as well as looking at the longer-term strategies focused, and actually if you could bring those up, focused on other community efforts in terms of addressing issues for the homelessness, economic stability. You heard a list of activities that the Board of Supervisors approved yesterday. Many of those factors will help the communities that are in need, and also looking at our data, communication, community engagement, behavioral health factors. We will continue what we are doing in these areas and expand where we can. And by doing all of these things, it will help to decrease the testing positivity for the areas that are in the lowest quartiles. Thank you.
Okay, we'll go to the next question.
Yes, this question is from Danny Freeman with NBC 7.
Afternoon, folks. A question for Dr. Wooten. What is the plan right now to work with Point Loma Nazarene University to test their dorm population?
Okay, Dr. Wooten. Dr. McDonald. Oh, Dr. McDonald's going to respond.
Yes,
That
thank
works
you.
too.
Yes, thank you for that question. Behind that question, as you know, the Point Loma Nazarene University announced to their community that they had a dozen new cases that had been identified, some of whom reside on campus in their dormitories. They actually met with us before their students returned, and we went over their plans on how to deal with potential cases on campus to be able to test, trace, and treat with isolation or quarantine individuals who might need those interventions. And so I would say that they are executing their plan, and we are supporting them doing that. They have actually done a substantial amount of testing already and have some tests pending, but we will be deploying a surge testing capability to the campus tomorrow to test the remaining number of students who need to be tested.
Thank you.
Okay, the next question, please.
This question is from Paul Sisson with the San Diego Union Tribune.
That was mentioned in. Thank you. Can you tell me a little more about the serological survey that was mentioned in Dr. Wooten's presentation a little earlier? Also a little more about lab upgrades for genetic sequencing, pattern recognition, and I think there was a third item there as well. But why do you believe that these are necessary? I think there were some concerns at first about the accuracy of serological antibody testing.
Okay, Dr. McDonald's going to respond.
Yes, I can address some of those components. You may have to remind me, because you had so many questions there, Paul. I'll first start with the serologic or survey testing. We are actually exploring how to actually do that based on the technology that's available to both conduct reliable serology testing and then how to actually then interpret it. That's been an evolving issue over the last number of months. But we would like to try to answer some questions using serologic information. That is, what is the current number of individuals who have antibodies present to the virus in the county, and would that give us information on how many people were exposed compared to the number that we have confirmed over time? And that may indeed help us understand how many more people are susceptible and help us direct our eventual vaccine strategies. So that is again, that's a plan that's under development based on the changing science of what serologic testing means. And that, I hope, answers that part of your question. And then there were two more parts, so you'll have to remind me what they are.
You mentioned some lab upgrades, I think, for genetic sequencing and pattern matching, and I wonder how you might use that investment.
Well, you know, currently we are working with some partners in the community, most specifically Scripps Research and Dr. Christian Anderson's laboratory, to help us do whole genome sequencing of virus, to help us understand how many viruses are circulating, which ones are dominating in which areas, and help us answer specific questions about specific outbreaks. For example, if there are 10 cases identified in a certain congregate facility, are all those viruses actually related to each other, indicating an introduction into that community, or are they unrelated, meaning that they have had multiple introductions? And so we are working now to understand how to bring whole genome sequence testing into our regular investigations of outbreaks. We have done some preliminary work with that with cases at San Diego State University, and we aren't ready to announce those results quite yet, but we should be able to do that soon. But we hope to be able to do this more and more to understand, again, the dynamics of the different strains that are circulating in the community. We are standing up that capability in our public health lab. We have technicians that are trained in the machines to do it, but the hard part is the software that actually does the analysis, and actually the ability to sequence that, or process those specimens so they can be sequenced. So that is, again, a developing capability that Dr. Wooten referred to.
I think there was one third piece of that that Dr. Wooten mentioned that had to do with additional staffing for rapid case investigations or something like that. It went by quickly. I couldn't quite remember exactly what was said, but if there's any more info on that.
I think she was referring to contact tracing and, again, the extensive efforts that the county has already invested but is continuing to leverage and, with the community partners who have the connections to the community, who are most trusted to be able to do that. And maybe Dr. Wooten can expand on that.
Also, Paul, we are expanding on our assessment teams to do the pre-outbreak work, and then those staff that are deployed into the field to conduct the outbreak assessments. So we are expanding that process. That's something that we already do, but we want to expand it as we see more outbreaks. So that was what I included, and I think that's what you were referring to.
Thank you.
This next question is going to be responded to by Dr. McDonald, and it has to do with people that have passed away that maybe weren't identified directly with COVID, and we'll go right to the question.
And this text question is from Mary Plummer with iNewsSource. She's asking, how well do you think the county has captured the greater loss of life tied to the pandemic, meaning people who have died due to reasons associated with the pandemic but not COVID itself? For example, avoiding hospitals or illnesses impacted by increased stress, for example.
Well, thank you for that question. I think that is an issue that's been on the mind of both the public and healthcare providers. What COVID has done is it's changed the dynamics between individuals in the community and their health providers. Some may be hesitant to get ongoing or preventive care. Some might be hesitant to go in for acute care because of concerns about infection control. And I think that go back to February and March when really we knew much less about this virus, we have done a lot of work, and most of that work has been done in the healthcare facilities and by the providers themselves to make sure that the environments are safe, that their patients are able to get the care that they need. Much of that is being delivered in telehealth now versus in person, and that they get the preventive care that they need, including immunizations and mammograms and all the other things that are recommended to screen for serious illness, to detect it early so that early interventions are made. I don't know that we have a good way of measuring that in real time. I think that we'll be able to know as more time goes by whether there have been some shifts in some otherwise preventable or otherwise treatable illnesses. But I would say overall, the number of deaths that have occurred that are related to COVID for San Diego County residents appears to account for most of the deaths that are occurring this year compared to previous years among San Diego County residents. And whether that means, though, in the microscopic that there may be some shifts there, we will have to look into that, and we are looking into that actively.
Dr. McDonald.
This last question deals with an event that apparently occurred at Fiesta Island, and I believe Gary Johnson is going to respond to this.
And this question is from Cliff Albert with Kogo Radio. Are you aware of a recent gathering of what appeared to be over 100 people on Fiesta Island, few if any wearing masks and no social distancing? If so, has the county taken any action?
Well, we appreciate that question, and we are aware of it after the fact. Our county's safe reopening compliance team typically does wonderful things when given early warning. In this case, we didn't get any early warning on this to be able to shape the environment, make sure that it was a safe activity and a permissible activity. Nor did we get any type of reports or official complaints logged in via our website or our phone hotline. So in that case, we may do some following up, but that's where we are with that particular case. Thank you.
Well, that concludes our questions for today. We will be back here again next Wednesday at 2:30. Until then, we certainly hope everybody wears their masks and social distance and do all the other things you need to do. But most important of all, please be safe, San Diego. Thank you.